población leucemia.
I study Catholic University Nursing School. My name is Cinthya Candolor.
Definition. Generally, we about the población leucemia when routine and symptoms that represent temperature and low temporal defects. Polygamy representation man. Patient personally or the modern movement, including schizophrenia and leukemia.
So a great deal of research is being done on ALL here. There is a clinical trial consortium that comes out of Children's and the Dana-Farber, where a number of different clinical trials are being run for children with acute lymphoblastic leukemia, including one main clinical trial for newly diagnosed children. And this has been a series of clinical trials that have come out of this program for many years. Every 5 years or so, with new changes to the treatment based on what we've learned from the most recent clinical trials. And that research really has two goals. One being to improve the chances of cure for children with ALL, and the other being to reduce some of the long-term side effects of treatment and ensure that children have the best possible quality of life through their treatment and beyond. In addition to the work that's, the research that's really being done directly with patients, there also is an enormous amount of work that's being done in the lab to understand the mechanisms of leukemia, how it forms, and what kind of new targets there may be for therapy. And so new treatments are being developed in the lab and hopefully will reach patients as time goes on. And so many people are working to try to make treatment of this disease better.
One of the nice things about being a pediatrician is that there are different ages that, you know, there are different preparations for, and so it's hard to answer that question for all children. Obviously for babies, making sure that the baby has eaten well and been getting good sleep and has some time before their treatment to do the things that babies do normally, whatever the developmental stage is for that baby. I think the same is true probably for school-age children and teenagers as well. I think for teenagers it's important to recognize that they are people who might have their own ideas about how to do things, and so engaging them in helping decide about things that they can control, like the timing of the chemotherapy, what day of the week would they prefer to be a clinic patient, what time of day, those kinds of questions. What do they want to wear? What do they want to bring? Those kinds of things are really helpful, I think, for teenagers, acknowledging their independence. And then for school-age children, I think distractions are the most important thing to bring, to be attentive to the kinds of things that distract your child, because children are of that age in particular distractible with videos and their sort of obsessions with dinosaurs or Pokemon or whatever, and those override chemotherapy very often if you play it right. The Red Sox, whatever it is that your child loves, they'll love while they're getting chemotherapy too.
was the amount of striking substances present in the blood with less than the visual in the body.
I'm a pediatrician, so ALL is the most common cancer of childhood, but no cancer in childhood is common. Overall, there are probably about 5,000 or 6,000 cases of ALL a year, half in adults and half in pediatrics. And in the treatments that we're focusing on, we're really looking at that group of patients that hasn't responded to regular chemotherapy. It depends whether we're talking about a kid or an adult. So in children, the overall response and durable response rate is very high, and so 85% of children who get modern chemotherapy have an excellent chance of remaining in remission, being cured of their disease. In adults, it's less than 50%, so it's a little bit more difficult.
As difficult the diagnosis and disease may be, many forms of pediatric cancers are curable, especially the most common presentation, leukemia.
Between 20 to 40% of children who have cancer usually have a form of leukemia.
Pediatric leukemia usually presents between the ages of 2 and 5. It differs from the adult disease in both treatment and outcomes.
Survival rate for childhood lymphocytic leukemia, or ALL, is somewhere between 85 to 90%. Those numbers are not reproduced in the adult population.
Callie Russell is a pint-sized cancer patient.
It was just 2 months after she turned 3 years old that we found out and she was diagnosed.
Now 4 years old, she's been through a lifetime of hospitalizations and treatments.
Callie was diagnosed with acute lymphocytic leukemia about a year ago, and she's in remission and she's doing great.
Her family could only watch and support her as she underwent a time-tested regimen of treatment.
The treatment method of choice is chemotherapy. It's systemic, whether we give it by mouth or give it IV or as a shot. And it gets into your bloodstream.
The first few weeks were rough because she had never had medicine before. We've not seen very many side effects from it, and she's made it a routine. She's made it a part of her daily life.
The treatment is prolonged. It takes years before doctors are confident the cancer is gone. Girls will undergo chemotherapy periodically for 2.5 years, with 3 years for boys. Parents will often describe it as a roller coaster ride.
There are many ups and downs. However, as you look back, the downs get less and less as you move further away from diagnosis.
The Russells are ready to put this long ride behind them and face the future with a healthy little girl.
She's our little hero. She's such a trooper, and that she can just overcome all of this and make light of it.
For Lee Memorial Health System, I'm Amy Osher.
Conclusion.
The overall loss percentage went solar, while the children will account the overseas leukemia and working movement lesser in white electron therapy to the patient of life as well as long understanding.
Thank you.